Can everyone see that?
Yes.
Good. It was nice to see quite a lot of familiar faces, but also some I've not seen for a while as well. So that's great. As Leighton said, we're going to just do an update really on where we're at as a research group at the moment, particularly obviously with all the changes that have been going on due to COVID as well. So just as a reminder, I think if you've been to a previous talk, you'll have seen this slide, just to give an outline of the work that we're involved in physical activity wellbeing public health research group. So two primary themes are primary prevention of chronic disease, but also the management of chronic disease. And we look at lifestyle behaviour change, particularly exercise, in relation to those two things. We do a lot of different research. So we run clinical trials, community-based projects, evaluations, literature reviews, and then more consultancy contract research as well, particularly more in the workplace wellbeing area. So the key aspects of our work, I've done all these as equal segments because they do all influence each other and they're all of equal importance. I'm going to start with talking about the income side of what we do, because obviously if we don't bring in income, we don't exist. And to achieve our income targets, we always need to make sure we've got a balanced portfolio of different types of work, because different types of work bring in different amounts of income. But we also need to make sure that we're allowing enough time to develop projects, so that we can actually go for those decent sums of money as well. Obviously, REF down in the bottom corner, it's important to all of us. And again, we need to make sure we have plenty of high quality papers that are submissible to REF. And also are starting to develop impact case studies. So we're actually starting to look at impact case studies for the next REF cycle now, so that we're going to have hopefully some strong ones for next time round as well. This time we've got one impact case study from the group, and we've also last year we published around 40 papers as a research group, obviously some of which will be submissible to the REF this time round. In terms of staff development being our other key area, because obviously without developing our staff, we're not going to achieve any of the other things that we set out to do. And that includes the teaching staff that want to be involved in research and helping bring them through and feel confident in getting income in through research. But also the early career researchers in our group and the more senior staff in our group, because actually we've lost quite a lot of senior staff, and even our senior staff are still technically classed as early career researchers. So we need to look out for the development really of everybody within the group. And then obviously student experience. So all of these other things enable us to have those real world experiences that we can pass on to the students in terms of guest lectures, internships, shadowing opportunities. Obviously shadowing is a little bit limited at the moment under the current guidelines. You know, we've obviously got to get research and things going, and it adds to the amount of people in the room, but it's something that is still in our minds to get back going as soon as we can. And then obviously dissertation supervision as well in areas of our expertise. This is just a reminder of the sorts of clients that we work with. And as we were saying about a balanced portfolio, we work with various charities, which obviously give us prestigious research, but don't always pay as much as perhaps the other end of the spectrum, where we get contract research that does pay all of our full costs. So we have to make sure we have that balance across the different sectors to ensure that we hit our targets. This is just to give you an idea of some of the projects that we are currently running. And the asterisk really is to highlight those that have had an impact from COVID. So most of them it's been delays because it's face-to-face work. So obviously Just Bowls evaluation, the Innovate UK pilot project that we're doing, we're just about to get that started again now with face-to-face follow-up. It's had a 6-month delay, so obviously we don't get any more funding in for that, but it has taken a hit. The exoskeleton project is with people with MS, so we are hoping that will start in January, but again that's had a 6-month delay so far. Active Against Cancer got pulled after the ethics went through, so some work was done on that, but we've not received funding on that. New Day, the cancer project, the pilot project is going ahead but delayed, but because data collection we haven't been able to do it, then the follow-up project we were hoping to get funded can't be funded because we haven't got the data from the pilot. So obviously that one's been affected. Osprey again is going ahead, but it's had a 6-month delay. So you can see our real priority is getting our research that we're doing back up and running, as well as getting new income in from different projects that we can run remotely. And it's, we've been putting in a lot of hard work to get those projects up and running. Just an example of some of the work that we are doing at the moment. So the Osprey project you saw on the previous slide, this one's looking, if you look at the rationale, of only 49% of eligible patients do enroll in cardiac rehab. So increasing the uptake will result in a lower hospital admission and death. So this is trying to address that issue. Simon, I think, is on this call. So if I get anything wrong or you have any questions on this project, I'm sure I'll be able to answer them. The study proposes to explore reasons why patients attend and drop out of earlier cardiac rehab, which parts are important for improving quality of life, and understanding what lifestyle behaviours patients intend to modify and which behaviours they do modify 6 months after cardiac rehab, and developing a solution using co-design. As I said, this project's had a 6-month delay, but the NHS ethics has just been provisionally approved, so that should be getting up and running shortly. Workplace wellness, as many of you know, we run the internal service here at SHU, but most of that was face-to-face work. We are currently running one wellbeing workshop a week online. We've upped that. We're running one-to-one nutrition and physical activity consultations online, and we've just developed a trialling an online lifestyle review session to replace the face-to-face session. But we're also getting face-to-face health screening up and running. So we've just put in the risk assessments for Col Hall and for the AWRC to see what people are interested in doing. Obviously, with not having as many people on site, we're still unsure what the uptake of that will be. And then externally, the Innovate UK project, again, we've just had clearance, and we're doing the testing in November for that project. This one is the exoskeleton project that we're working with University of Sheffield and Sheffield Teaching Hospitals on, and it's working with people with more severe MS. So it's looking at whether we can use an exoskeleton to help people to exercise at a level that's beneficial to their health. So it's a pilot project, and we're comparing it against a standard exercise approach. And it's obviously been delayed with COVID because they're a high risk group, but we're hoping that will start in January. We're just making sure the ethics is in place, because it was running at the hospital and it's now going to run at the AWRC, which is great for us. So what next? We're just starting to redevelop our strategy for the group. So we'll be doing that over the next few months. So these are just a few thoughts around the short-term things we have to do, and we'll be developing the sort of medium and long-term aims, over the next few months. So what we want to achieve is, obviously, we want to establish our reputation as a leading research group in this area, so the exercise and physical activity for the prevention and treatment of chronic disease, and make strategic steps towards a cost-neutral research group. So obviously the current climate has hit us quite hard, and we want to make sure that we can bounce back as strongly as we can. How will we do this? Obviously, we need to get current projects moving as soon as possible, but we need to explore new funding opportunities that have remote delivery options, and also there's a lot of COVID-19 calls out there that we can respond to as well. So there are new opportunities for us. We need to support current staff to develop their research careers, and continue to conduct and publish high quality research, which obviously we've been doing. Make sure our portfolio is balanced, and we need to make sure we can re-establish our staffing levels, because we've not been able to re-recruit, and that will enable us obviously to provide those real world experiences to students that I talked about earlier. So that's it. If anyone's got any questions, or if they don't want to ask them now, they want to get back to me, then that's absolutely fine, and I'll stop sharing so I can see you all.
Thank you, Anouska. That was really interesting, actually, and quite stark to see just how many asterisks were on that slide, and how many projects have been impacted by COVID. So has anybody got any questions for Anouska? Jeff?
Go on. Anouska, what would you say is the greatest opportunity that the current environment has created in terms of research and potential funding?
I think it's obviously there's the research. There's a lot of research around COVID, and and the long haul and the recovery, which we're involved with at the AWRC. So we are looking into a lot of opportunities in that sector. Also from a workplace wellness perspective around remote working and the issues that people are having around decreases in physical activity. So there are a lot of opportunities out there, and the research is coming through in those areas. It's just obviously we need to be able to respond to those and try and put ourselves in a position to win that income.
Yeah. Great, thanks, Anouska.
I just had one question around really your thoughts on the best way that the teaching staff can look to get involved within your research group. There are a lot of people within the teaching team who have interest in physical activity more broadly, and how they can try and get involved.
Well, obviously they can come along to the team meetings. So we have those pretty much fortnightly on a Wednesday morning at 9:30. So they can come along to those to find out about what we're doing, and that has all the updates of projects and things that are going on. And also if they get in touch with me and express an interest in the sorts of areas that they're interested in, so that we're aware as a group what people do want to get involved with and looking at doing.
Great, thank you. I know a number of colleagues are teaching at the moment. I had to send their apologies for this meeting, so maybe that'll be really useful for them.
But yeah, if they just get straight in touch, and also they can, if they're interested, we can add them to that circulation list for the research group as well.
Perfect.
I'll just add to Anouska as well. If anybody has any research ideas that they would like support working up, we're always welcome to come and have a chat with us as well.
Thank you, Simon. Great.
Thanks.